Mr. President, for years, I've been calling on Democrats and Republicans to work together to improve the health care law. There are some like myself who recognize the benefits of the existing health care law, as well as the areas that need fixing. And I have proposed that we partner together to strengthen our health care system. For the first time, we have legislation in the Senate that has broad bipartisan support and would improve issues with our health care system by stabilizing the individual marketplace and lowering premiums for Americans. This is what I've long pushed for. Today, it's more important than ever that we act to pass this bipartisan legislation, and I'd like to take a few minutes to explain why. Beginning next week on November 1st, millions of Americans, including Hoosiers, can sign up for health care coverage through the individual marketplace. Unfortunately, as consumers prepare to shop for health insurance plans, there is uncertainty and instability in the marketplace and confusion and higher prices for consumers. That wasn't the case earlier this year, as both public and private analysis showed that individual marketplaces were relatively stable and improving. For the last 10 months, though, the administration has worked to make it harder for Americans to access affordable health care and destabilized the markets. For many months, the administration refused to commit to continuing important cost-sharing reduction payments that reduce costs for consumers, and even worse, has played politics with these payments. This culminated with the administration's announcement earlier this month that it would discontinue cost-sharing reduction payments. This decision came only weeks before open enrollment. There's no disputing a simple fact. The administration's actions created uncertainty for insurers, causing some to significantly raise rates and others to leave the market altogether. As a result, many Americans will be forced to pay more for health care plans through the individual marketplace. For example, CareSource, an insurance company that offers insurance to Hoosiers through the individual marketplace, told me earlier this year that rates would rise 2.2% if the federal government committed to continuing cost-sharing reduction payments. Because the administration refused to do so, rates for CareSource plans are, on average, now 20% higher for Hoosiers than last year. Centene, the other insurer offering coverage in the marketplace, will have average rate increases of nearly 36%. In addition to higher rates, it will be harder for Hoosiers to find help enrolling in health care plans because the administration slashed 82% of Navigator program funding for my home state of Indiana, the deepest cut of any state in the country. Consumers also have a shorter period to enroll than past years, and the administration plans to do maintenance and shut down healthcare.gov for 12 hours on all but one Sunday throughout the open enrollment period. It does not have to be this way. As I said for years, there's another path, a bipartisan path. We should work in a bipartisan manner to improve our health care system, all Americans working together. I've pressed the administration to commit to providing stability to health insurance markets and to work together on bipartisan solutions that reduce health care costs and ensure access to quality medical care. Over the past several months, I've engaged in bipartisan conversations and meetings with my colleagues to discuss ways we can partner together to stabilize our health care markets. We've talked to a range of health care experts. There's been a good faith effort to find common ground on steps we can take to lower costs for families. That's what we should be doing. After participating in this effort, I was pleased that Senators Lamar Alexander and Patty Murray reached a bipartisan agreement last week. It makes improvements to our health care system and helps reduce costs for our families. I'm proud to co-sponsor this legislation. It continues cost-sharing reduction payments that reduce consumers' deductibles. It also reduces copays for 2 years, restores funding to help Americans navigate signing up for health insurance, and enables more flexibility for states without undermining essential health benefits or harming people who have pre-existing conditions. If this legislation came to a vote today, I am confident it would receive more than 60 votes here in the Senate needed to pass. It has wide-ranging support from both Democrats and Republicans. It has bipartisan support, not only in the Senate, but also from Republican and Democratic governors all across the country. We've heard from groups, including the American Medical Association, the U.S. Chamber of Commerce, and AARP, urging Congress to move forward on this proposal because it's common sense. It benefits families. It helps stabilize the insurance markets. It's our job to protect families from unnecessary increases in the cost of health care, particularly those within our control. We have an opportunity to do that with the bipartisan Alexander-Murray Agreement that we achieved by working together. The health care debate should not be a political game. The stakes are way too high for that because health care impacts the well-being and the economic security of millions and millions of Americans. I said over and over, the American people expect us to work together to try and make life a little bit better. At the very least, we should do no harm. The Alexander-Murray Agreement not only provides relief for families, it actually helps put them in a better place. There's no doubt we have more work to do, but this proposal is an important first step. Let's strengthen the health care system and make health care more affordable with this bipartisan solution.